Sturgeon. First Minister.
Thank you, Presiding Officer. I'll give an update today on the latest COVID situation and also provide an assessment of the current course of the pandemic. First, though, today's statistics: 2,771 positive cases were reported yesterday, 12.8% of all the tests that were carried out. 779 people are currently in hospital with COVID, which is 8 more than yesterday, and 57 people are receiving intensive care, which is the same number as yesterday. Sadly, a further 17 deaths have been reported over the past 24 hours, and that takes the total number of deaths under this daily definition to 9,406. And again, I want to send my condolences to everyone who has lost a loved one. More positively, the vaccination programme continues to make very good progress. I can confirm that 4,331,574 people have received a first dose and 3,930,317 have now had both doses. In total, 88% of all those over 18 are now fully vaccinated with 2 doses. In addition, 76% of 16 and 17-year-olds and 56% of 12 to 15-year-olds have had a first dose. Until now, of course, only a single dose has been recommended for these age groups, but following yesterday's updated advice from the JCVI, we're now preparing to offer second doses to 16 and 17-year-olds. I will say a bit more about the progress of the booster programme later. However, it is worth pointing out that on first, second and booster and third doses, Scotland is currently the most vaccinated part of the UK. That is down, of course, to the incredible hard work of everyone involved in organising and delivering the programme, and I want to record my thanks to each and every one of them. Today's weekly update, of course, coincides with the latest 3-week review point for the remaining COVID regulations. And so I can confirm that at our meeting earlier today, the Cabinet agreed to keep the current regulations in place with no immediate changes. However, we also considered, though we have not yet reached final decisions, the possibility of future changes to the COVID certification scheme, and I will say more about that shortly as well. The numbers reported in recent days here in Scotland, which I'll come on to talk about in more detail, illustrate the need for continued precautions. So too does the challenging situation being experienced again across Europe. Several European countries are currently dealing with a sharp increase in cases. Infection rates in Germany have reached their highest level since the pandemic started. The Netherlands reintroduced some COVID measures last week. Ireland has done so today. And Austria has just introduced extremely tough restrictions on people who are not fully vaccinated. All of this is a reminder that governments everywhere are grappling with the same issues and dilemmas that we are. The threats posed by COVID are very much still with us, even though they have been mitigated by vaccination, and the race between the virus and the vaccines has not yet been won. The situation here in Scotland also bears that out. However, before I give an update on the overall trends in Scotland, I want to say a few words about the impact of recent events in Glasgow. I will reflect more generally on COP26 in a further statement to Parliament later this afternoon. However, while we can't yet draw final conclusions, I can confirm now that there is no sign so far of any significant spike in COVID cases associated with COP26. Rigorous measures were put in place to minimise the risks of transmission. For example, anyone entering the main summit site, the blue zone, had to provide evidence of a negative lateral flow test result. Information published earlier today by Public Health Scotland suggests that of the people officially affiliated with COP26, approximately 4 in every 1,000 tested positive for COVID through routine lateral flow testing. This contrasts with survey data for the Scottish population as a whole, which suggests that last week 12 people in every 1,000 had COVID. And in total, since the 15th of October, 291 people with COVID across Scotland reported attending a COP-related event. That includes satellite meetings and demonstrations, as well as the main summit itself. That represents less than half of 1% of all those who tested positive for COVID over the past month and reported through Test and Protect. All of this, at this stage, Presiding Officer, suggests that the mitigations that were put in place for COP were effective, and I want to put on record my thanks to delegates for their compliance, and indeed to everyone who worked so hard in the run-up to and during COP26 to secure the safest possible environment. More generally across Scotland, we have seen a gradual increase in cases over the past 2 weeks, from just over 2,500 new cases a day to approximately 3,000 cases a day at this stage. It is important to note, though, that this headline figure masks some distinct variation between different age groups. For example, cases amongst under 60s increased by 14% during the past week, and much of this increase was in people under the age of 20. By contrast, cases in the over 60 age group fell over the past week by 11%. Now, this is likely to be due, at least in part, to the success of the booster programme, which of course is prioritised among the older population, and I'll say more about that shortly. The decline in cases amongst older people may also explain why, despite the overall increase in cases, the numbers in hospital with COVID have reduced slightly in recent weeks. 3 weeks ago, 917 patients were in hospital with COVID. Today, there are 779, and the number in intensive care has also fallen, although very slightly during that time, from 59 to 57. However, all of that said, the number of patients in hospital with COVID is still extremely high. If cases continue to increase, then notwithstanding the age profile, we are likely to see hospital admissions and occupancy start to rise again. In addition, the NHS is currently treating people who are in hospital for care which had to be delayed by earlier COVID countermeasures. And of course, as we go further into winter, we can expect other seasonal pressures, for example, flu, to increase. All of this means that the NHS is under extreme pressure, and we continue to work closely with health boards to address and mitigate these pressures as far as we can. The vaccination programme, of course, continues to be critical in reducing the direct health harm caused by the virus. I mentioned a moment ago that the decline in COVID rates in older age groups and the fall in hospital admissions may well reflect the impact of the vaccine booster campaign. I can confirm that more than 1 million booster jags have now been administered, and over 70% of the over 70 age group have now had a booster. We know that a booster jag significantly increases the effectiveness of the vaccine, so this high level of uptake is extremely important, and we will continue to push it up as far as possible. The programme took a further step forward yesterday with the launch of the online booking portal. Everyone aged 50 to 59, together with unpaid carers and household contacts of the immunosuppressed and anyone eligible for a vaccine who's not yet had an appointment, can now book online at NHS Inform. Since yesterday morning, more than 54,000 people have made online bookings, and more than 8,000 people have made bookings through the National Helpline, which can be called on 0800 0300 8013. That's 0800 030 8013. It is, of course, important to remember that boosters can only be given 24 weeks after someone's second jab. Therefore, for many in the 50 to 59 age group, appointments will only be possible from December onwards. It's also worth pointing out that people living in Orkney, Shetland, the Western Isles and the NHS Highland Health Board areas will not use the online booking system, but instead receive information direct from their health board about local appointment arrangements. As I mentioned earlier, the JCVI updated its advice yesterday. In addition to recommended second doses for 16 and 17-year-olds, it also recommended booster jags for people in their 40s. I very much welcome this, and the Scottish Government will now move to implement this new advice as quickly as we can. And we continue to work with health boards to ensure that the overall programme is delivered as rapidly as possible. However, it is worth taking stock of the situation as of now. This winter vaccination programme is the largest and the most complex ever undertaken in Scotland. However, since the first week in September, more than 3 million flu and booster jags have been administered. Take-up rates have been encouraging, and this is providing vital protection as we head into winter. So once again, I'm hugely grateful to everyone helping get jags into people's arms as quickly as possible. And I also want to take this opportunity again to urge every single person who is eligible for vaccination, whether for a first or second jab or a booster or third jag, to please take up the offer without delay and get the flu jag too if you are eligible. Getting vaccinated remains the single most important thing any of us can do to protect ourselves, our loved ones and our communities. It is impossible to overstate how important it is to get vaccinated, so if you haven't already, please do so now. You could be saving your own life or the lives of your loved ones. You will be reassuring others, including those most at risk, some of whom have clinical conditions that mean they cannot get vaccinated themselves. You will be helping those working in the NHS, and you will be maximising our collective chances of getting through this winter without the need to reintroduce any restrictions. Presiding Officer, in my view, choosing without good reason not to be vaccinated is deeply irresponsible. Getting vaccinated, on the other hand, is a civic duty, and it is the most precious gift we can give to others at this time. The vaccine programme is and will continue to be the bedrock of our efforts to control COVID. However, other baseline mitigations remain in place, and they are also important. Lateral flow testing, as I mentioned earlier, appears to have been effective in limiting transmission during COP. That should remind all of us that these tests are a really important way of detecting infection, particularly in those without symptoms, and therefore preventing onward spread. So I would again encourage everyone to do a lateral flow test at least twice a week, and especially if you are attending events or mixing with people in other households. The tests can be ordered free through NHS Inform or collected from test sites and local pharmacies. Face coverings also continue to be a simple but important mitigation and remain a legal requirement on public transport, in shops and when moving around in hospitality settings. Please also continue to work from home when that is practical. I'm today asking all employers to look again at whether more workers could be supported to do more work from home over the winter period. Lastly, good ventilation is vital. If any of us are having people visit our homes, we should open a window even slightly to let some air flow through the room. Within the public sector, we've taken significant steps to improve ventilation, for example, funding for carbon dioxide monitors in schools. And in September, we announced the establishment of a £25 million fund to help businesses improve ventilation. This fund opens for applications next week. Businesses such as restaurants, bars and gyms will be able to claim back costs of up to £2,500 for measures like the installation of carbon dioxide monitors or improvements to windows and vents. More information on eligibility has been published today on the Find Business Support website. All of these basic mitigation measures are really important at this stage, but of course some of them are also valuable long-term investments. For example, better ventilation won't just reduce the spread of COVID, it will also help reduce the spread of other airborne viruses now and in the future. And there's an important point here which is worth stressing. When we talk, as many do these days, about living with COVID, it's important that we don't think of this as simply giving in to the virus. Instead, it is about making sensible changes that allow us to return both to greater normality and to better health. Presiding Officer, the final mitigation measure I want to talk about today is the COVID certification scheme. It is the strong view of the Scottish Government that this, together with the other measures still in place, makes an important and proportionate contribution to stemming COVID transmission. The value of certification is also recognised in other countries, many of which require certification for access to a much wider range of services than is currently the case in Scotland. Wales, for example, expanded the scope of its own scheme yesterday. It now applies to theatres, cinemas and concert halls, in addition to the same range of venues as in Scotland. The Cabinet discussed possible changes to the current certification scheme at our meeting this morning. We intend to take a final decision next Tuesday in light of the most up-to-date data. In the meantime, later this week, we will publish an evidence paper and consult businesses on the practicalities of implementation should any changes be made. However, while final decisions have not yet been reached, I want to provide an update on the issues under consideration. I should also say that we would provisionally intend for any changes we do decide to make to the scheme to take effect from December the 6th. When the scheme launched on 1 October, we judged that it was not appropriate at that time, given the imperative to drive up vaccination rates, to include testing as an alternative to proof of vaccination, but we indicated this would be kept under review. So we will be assessing in the coming days whether, on the basis of current and projected vaccination uptake rates, we are now in a position to amend the scheme so that, in addition to showing evidence of vaccination to access a venue, there will also be the option of providing evidence of a recent negative test result. That is already a feature, of course, of many other countries' certification schemes. We're also considering whether an expansion of the scheme to cover more settings would be justified and prudent given the current state of the pandemic. Again, let me stress that we have not at this stage taken a decision to extend the reach of the scheme. However, to allow us to engage openly with businesses in the coming days about the pros, cons and practicalities, I can confirm that the kinds of settings that might be in scope would be indoor cinemas, theatres and some other licensed and hospitality premises. We would, of course, retain exemptions for those under 18, for those who cannot be vaccinated or tested for medical reasons, for people on clinical trials and for those who work at events or in venues subject to the scheme. Exceptions would also be retained for worship, weddings, funerals and related gatherings. I will give a further update on this in next week's statement, and if we decide to propose any amendments to the regulations on certification, Parliament will have the opportunity to discuss and debate these amendments. Presiding Officer, I am acutely aware that many businesses want us to remove mitigations, including certification, not extend or tighten them. I understand that, but all of our decisions are and must be motivated by a desire to keep people safe, but also to get through what will be a challenging winter without having to reintroduce any restrictions on trade. We want, if possible, businesses to stay fully open over Christmas and through the winter, while also keeping COVID under control. If an expansion of COVID certification can help us do that, it would be irresponsible not to consider it. Presiding Officer, as the detail of this statement makes clear, and as the situation across Europe also shows, the need to carefully manage this pandemic still deprives us of any easy options. While we hope very much to get through winter without reintroducing any further restrictions, as some other countries are now starting to do, we do have a duty to keep proportionate options under review, and we will do so. To assist with and give an insight into the factors guiding our considerations, we are also publishing an updated strategic framework today. This covers in more detail many of the issues I have already summarised. And one of the points it reiterates is that all of us across society, individuals, businesses and other organisations, must continue to play our part in helping curb the spread of the virus. For that reason, Cabinet Secretaries are continuing to work with COSLA, individual local authorities and businesses on the actions we need to take to reduce transmission, preferably without additional restrictions. And I will close again by reiterating what we can all do to protect ourselves and each other. So firstly, please do get vaccinated if you're eligible and haven't yet done so. As I mentioned earlier, that includes going for a booster jab when you're invited. It is never too late to get vaccinated, and it remains the single most important thing any of us can do right now. Second, please test regularly with lateral flow devices. These, of course, can be ordered through NHS Inform or collected from local test sites or pharmacies. If you test positive or are identified as a close contact or have symptoms of the virus, please self-isolate and book a PCR test. And third, please comply with the mitigation still in place. Work from home when that is possible, wear face coverings in indoor public places, shops, public transport and moving around in hospitality, wash hands and surfaces thoroughly and meet outdoors if that is possible. That obviously gets harder through the winter, but it is the case that outdoor environments are safer than indoors. And when you are meeting indoors, try to open windows. Anything to improve ventilation will help. All of these precautions do still make a difference. They will protect us and those around us, and they will help to ease the burden on our NHS. So I ask everyone to continue to stick with them and thank everyone for doing so.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business. And I'd be grateful if members who wish to ask a question were to press their request to speak buttons now. And I call Douglas Ross.
Thank you very much, Presiding Officer. It's vital that everyone who can have a COVID jab goes out and gets it as soon as possible. The vaccine, including the booster jab, is our best weapon against this virus. And that's why we've called for the reopening of mass vaccination centres. This will ensure that, alongside the current local delivery programme, we maximise the opportunities for people to get their vaccine booster. So will the First Minister agree to reopen these mass vaccination centres so we can speed up the booster jab rollout and help to protect people quicker? Today, the public were expecting a statement that delivered clear decisions. We all were. That was the message The Deputy First Minister was sent out to give this Parliament last week. Instead, we're being told once more to wait until next week. The government has delayed again, creating wholly avoidable uncertainty. Businesses are once again being left in the dark and treated as an afterthought. They might have less than 2 weeks to adapt to changes to the vaccine passport scheme at one of the busiest times of the year for the hospitality industry. And this has a big impact on their staff as well. It is a total lack of respect for Scottish businesses who the SNP expect to shoulder the costs of their vaccine passport scheme. The Deputy First Minister said last Tuesday that this government would discuss options with businesses over the course of this week. So can the First Minister give a clear answer and tell us the outcome of those discussions over the last week? The government must know who might be impacted. So let me ask the First Minister the same question I asked the Deputy First Minister last week. Exactly which businesses are the government still considering expanding the vaccine passport scheme to? Because she mentioned, and I quote, some other hospitality venues. Which hospitality venues have to prepare for this added burden? And finally, the First Minister has just said, and I quote, we want, if possible, businesses to stay fully open over Christmas. We know the government wants to keep options open, but will the First Minister be clear to Scottish businesses and the jobs that depend on them? Does that statement mean the SNP government are considering closing businesses and premises over the winter months?
First Minister.
Presiding Officer, it pains me to say this, but the immaturity and irresponsibility of Douglas Ross in the face of this virus continues to be utterly breathtaking. Is he, I know he's had other things in his mind in recent days, but is he oblivious to what is currently happening across Europe, where this virus is on the rise again, and governments everywhere are once again having to grapple with the most difficult decisions? We are seeking to do that in a responsible way. That's what we have done throughout, and we will continue to do that in the period ahead. Two issues were raised in particular, one on vaccination. We are organising the vaccination programme in this phase in the way that makes best use of resources and vaccinates people as quickly as possible. One of the things I've learned in recent weeks is whatever we decide to do, Douglas Ross will probably oppose it. So when we introduced a vaccination programme for younger teenagers that wasn't principally school-based, that was criticised, but then it turned out we managed to vaccinate those younger teenagers quicker than any other part of the UK. Across every single dose of this vaccine right now, Scotland is the most vaccinated part of the UK. We're not complacent about that. We continue to press to speed this up every single day. But this vaccination programme is going extremely well, and perhaps once in a while Douglas Ross could find it within himself to thank those who are working so hard across the country to make sure people are vaccinated. And on the issue of COVID certification, it's simply not an option right now for any government across Europe or much of the world to do nothing in the face of this virus. The easiest thing, of course, is to oppose everything that governments decide to do to try to keep people safe. If I had, Douglas Ross bemoans the fact that Cabinet hasn't taken a final decision yet. If I had stood up here today and said we had taken a final decision to expand the reach of the certification scheme, he would have criticised that, of course, and said that we were acting too quickly, that we weren't taking account of the up-to-date data. We have decided to consider this carefully, to take account of the up-to-date data and reach a decision next week. In the meantime, we will publish an evidence paper and we will consult with businesses on the practicalities and the pros and cons. And we will decide which businesses, on the basis of the data and the evidence I've set out today, in order to give people an update on what we're considering, the sectors that we are considering. And people only have to look around at the UK, Wales right now, Ireland, which is extending its COVID certification, and many countries across Europe, to see that actually most governments are grappling with these same difficult decisions. The easiest thing in the world right now, as Douglas Ross has found out, is to oppose everything. But when you have a duty, as government does, to try to keep people safe, then the decisions are harder than that, and we will continue to take them with an intense degree of responsibility.
Anna Sarwar.
Presiding Officer, I'd like to start by offering my condolences to all those that have lost a loved one and to recognise those who continue to put every effort into the front line and keep us all safe. I would urge the Government, though, to do more than just applaud them and thank them, recognise and reward them too when they come forward with their own pay disputes. The Government has still not fixed the tools they already have and are now instead looking at expanding a system that the Deputy First Minister himself said he had no evidence that was reducing cases of COVID. The vaccine works. It reduces hospitalisations, it reduces death rates, it reduces cases of long COVID. But it does not stop you from getting the virus, and it doesn't stop you from spreading the virus. The First Minister in her statement said that lateral flow testing helped to reduce transmission at COP. She has been arguing the opposite in relation to the vaccine passport scheme. At every point in the process of developing vaccine passports, we have argued the importance of a negative test. In fact, every single scheme that the First Minister quoted in her statement and in her response includes the use of a negative test. So in the coming week, accept you got it wrong, admit that testing should always have been at the heart of our COVID reduction strategy, and commit today to including a negative test in any reformed or expanded scheme, to meaningfully engage with the sectors impacted, to share the evidence, to consider the practicalities, and provide financial packages that stop businesses going under and people losing their jobs.
First Minister.
Firstly, on reward for those who work so hard in our National Health Service, I would dearly love to be in a position to give a higher pay rise than we have, and we will always seek to maximise that. But I do think it's important to put on record that NHS workers in Scotland, Agenda for Change workers, are receiving this year the highest pay increase of any NHS workers in any part of the UK, including where Labour is in government. So perhaps we should judge on what they do, not just on what they say. On the issue of the vaccine certification scheme and the inclusion of a negative test, this is a finely balanced judgment. When we have take a decision to introduce a scheme with the express objective of using that, at least in part, to drive up vaccination rates, it makes no sense to have an alternative to vaccine initially as part of that scheme, because then we wouldn't have seen. There is perhaps an argument here that one of the reasons why we are currently the most vaccinated part of the UK is that, at least in part, our vaccine certification scheme has helped to drive vaccine uptake. Now, there comes a point where your consideration changes because you make a judgment that we have already got all of the gains of increased vaccine uptake, and therefore we can move to include LFD tests. I understand the importance of LFD tests as part of a package of measures. That's why every week when I stand here, I talk about the importance of them. These are careful judgments to take. We have taken careful judgments up until now. We will not always get these judgments right, but we will continue to take them responsibly and taking account of all of the evidence. We will, as I said in my statement, publish an evidence paper this week. We will continue to talk to businesses, and we will continue to arrive at these very difficult decisions as carefully as we possibly can. I know that for the opposition here, they want to say that we just need to do nothing and everything that we put forward is opposed. That is an easy option. But when you're in government, there are no easy options, particularly in the face of a global pandemic.
Alex Cole-Hamilton.
Thank you very much, Presiding Officer. Presiding Officer, if any proof were needed that vaccine certification is unnecessary and there are better alternatives, then it can be found at COP26. The First Minister just said herself that it was the safest possible environment. With using daily LFTs, attendees were 3 times less likely to test positive for COVID-19 than the general population where vaccine certification is at large. We know that LFTs are superior to vaccine passports in 2 significant ways. Firstly, they provide an on-the-day snapshot of your COVID status rather than your vaccine status, which helps venues ascertain who is sick and who is well. And secondly, perhaps most importantly, it prevents the need for you to pass part of your medical history or evidence of recent treatment to somebody who is not your clinician. A mixed bag or a combination of these 2 schemes will not cut it. So will the First Minister abandon vaccine certification entirely and build a scheme built entirely around lateral flow testing? Thank you.
First Minister.
No, I won't, because I think my duty to try to keep the population of Scotland as safe as possible means that I can't just take the easy options that Alec Cole-Hamilton might put forward. And I think he misunderstands the package of mitigations that were in place around COP26, where part of the protections were that delegates were asked to be double vaccinated before they arrived. We offered vaccination to people who were coming from countries where that wasn't available. And then LFD tests, of course, were an additional precaution over and above that. So it's easy to be selective, but it is perhaps better to look at the whole package of measures that were in place. And in terms of the wider issue here, when you have a scheme that is partly about driving up vaccination rates, then it makes no sense to give an alternative to vaccine because then you undermine the objective of your scheme. And it is really important. Vaccines have limitations, although they are hugely effective. LFD tests are effective, but also have limitations. We need to use all of these tools at our disposal to drive rates down as far as possible and keep people as safe as possible. And that's the obligation and the responsibility that this government will continue to take seriously, even when it means unpopular decisions every single day that we're in this pandemic.
Annabel Ewing, to be followed by Murdo Fraser.
Thank you, Presiding Officer. A significant continuing impact of the COVID pandemic has been the restriction on face-to-face meetings with GPs, which is impacting on people across my Cowdenbeath constituency and indeed across Scotland. Can the First Minister therefore advise as to what steps are being taken to improve patient access to GPs and whether the need for the current 2-metre infection control requirement in healthcare settings will be kept under review?
First Minister.
Well, our recovery plan includes working with GPs to restore face-to-face consultations in surgeries. Public Health Scotland has already published updated guidance for primary care settings, covering key issues like physical distancing, which is now 1 metre, not 2, access for patients and wider infection prevention and control, and this will be kept under review. We aspire to return to a greater availability of face-to-face appointments. However, a number of patients will wish to continue with phone or video consultations where clinically necessary. The option to have a face-to-face consultation should always be available. Our winter funding package will help increase NHS and social care capacity over the winter, and that of course includes funding for accelerated recruitment to aid general practice.
Murdo Fraser, to be followed by Eleanor Whittam.
Thank you, Presiding Officer. The First Minister in her statement recognised the very substantial concern that already exists in the business community about any extension of the vaccine passport scheme, when some hospitality businesses are already reporting a 40% loss of trade. Now other businesses could face a similar loss of trade and additional costs in providing extra staffing with just 2 weeks to prepare for changes. If the Scottish Government goes down this route, will it provide a package of additional financial support for those businesses which are affected because it is already badly required?
First Minister.
We'll continue to consider additional financial support as necessary. In fact, on a different issue today, I've just announced or confirmed additional financial support to enable businesses, including bars and restaurants, to improve ventilation. So we will continue to look very favourably at any argument that is made there. I think Murdo Fraser and others have to be very careful with this argument that because trade is down, that is an argument against measures to make settings safer. I've spoken to many people, and I appreciate this will not be a unanimous view, but I've spoken to many people anecdotally who say that the reason they're not going back to pubs and restaurants is because they don't yet feel safe enough, and that actually if people's vaccine records were being checked, that would make them feel safer and perhaps more likely to go back. So there are arguments in both directions on this. I understand how difficult it is for hospitality, for the tourism trade and for other sectors that have been so badly affected. But the key to getting back to normal is to firstly keep COVID under control and then build the confidence of people to start going back to normal life. And we've got to use every possible tool at our disposal to do that.
Eleanor Whittam, to be followed by Rhoda Grant.
I've had a number of constituents contact me to raise their concerns about the lack of access to general dental practitioners for all but emergency treatment, and that such treatment is often framed around minimum interventions. There have also been issues with people moving to Carrickmillock and Doon Valley and not being able to register with a dentist. Can the First Minister advise when general dental practices will resume more routine services?
First Minister.
Well, from, I think, early November last year, when the full range of care and treatment was made available, we've been working to increase patient access in NHS dentistry. That has included additional funding for ventilation and improved dental drills, for example. We're in discussion with the BDA to support dentists and put patients at the centre of building a sustainable NHS service. And from February next year, we'll bring in enhanced fees for a range of treatments, including a more comprehensive examination supporting NHS dental teams to clear the backlog in routine care that built up during the course of the pandemic. We've already provided £50 million of financial support, plus an additional £35 million of PPE to ensure that dental services can emerge well placed to care for patients across Scotland.
Rhoda Grant, to be followed by Gillian Martin.
Thank you, Presiding Officer. A constituent contacted me after the instructions with the lateral flow test kit advised her to record the results through an NHS Scotland website. The UK Government website sends confirmation of a result within minutes. My constituent discovered that the Scottish website can take up to 24 hours. This is useless when confirmation is required the same day as the test in order to visit loved ones in a care home. Can I ask the First Minister why the wait times for the Scottish website are so long, and whether there is a need for a separate Scottish system when the UK government system works?
First Minister.
I'm genuinely more than happy to look into that in a bit more detail. The advice is for people doing LFD tests to record the result of those tests through the UK website. I've been doing that myself every day for the past couple of weeks and do it regularly. So that is the advice. So I'm not entirely clear exactly what website is being referred to, but if the details can be passed to me, I'm happy to look into that and provide any further information and advice after I've had the opportunity